Hello and welcome to The Art of Aging, which is part of the Abundant Aging podcast series from United Church Homes. On this show, we look at what it means to age in America and in other places around the world with positive and empowering conversations that challenge, encourage, and inspire everyone everywhere to age with abundance. Our guest today is Tom Beauregard. And I'll tell you, I don't think there's much he can't tell you about aging innovation in the healthcare sector. And we're here to talk about a pretty important subject, which is the looming crisis that we're going to have in long-term care, the affordability of long-term care, and how we can start now to address it. Tom has over 30 years of innovation experience across the healthcare, public policy, academia, and nonprofit worlds. He is the former executive vice president and chief innovation officer for a small company called United Health Group, where he oversaw R&D for both United Health and Optum. Additionally, he's a former national practice leader of A.M. Hewitt, as well as a senior advisor on the board of Healthsperian. And I think most importantly, he and his team are building something pretty special with their venture HCG Secure, which was founded in 2019. HCG Secure is an innovative developer of fintech solutions, which are meant to address the future costs of long-term care, our subject today. And Tom was inspired to found HCG Secure when his parents reached an age where they were unable to fully care for themselves, but wished to age at home. Limited by geography and his parents' needs for local resources, he found the process both overwhelming and difficult to find solutions to ensure that his parents were receiving the best possible care from afar. And that's, of course, not an uncommon thing. Stunned by the lack of coverage and resources to support these needs, Tom made it his mission to create solutions that offer the network and coverage needed for individuals and their loved ones to age comfortably in the places they choose to call home. As you might expect, Tom went to college. He's a graduate of Hobart and William Smith Colleges, and he's got an MBA from the University of Connecticut. He also received an Emmy for his work with the National Diabetes Prevention Program in partnership with YUSA and the Centers for Disease Control and Prevention. It was called Project Not Me, and he was executive producer. So, Tom, welcome.
Thanks, Mike. Really happy to be here.
Awesome. And I do want to put a quick plug in for United Church Homes' Ruth Frost Parker Center, the sponsor of this series and also of our annual symposium in October. Visit unitedchurchhomes.org/Parker-Center for more information about its good works, this year's topic, and how you can get involved. All right. So, Tom, right out of the bat, I got to ask you, you've got the Emmy. Is it the Grammy, the Oscar, or the Tony that you're going for next? Because I know that's on your list.
Yeah, none of the above. The Emmy was kind of a fun outcome of an important project that we did at United. But no, I think that's the end of my big award career.
All right, so we're going to let Sir Elton John have it then, I guess. He can step into that spotlight. But look, I mean, you've had a very long and well-respected career at United. You're definitely a very well-known leader in the healthcare world. But now, with HCG Secure, you've delved into fintech. You've delved into the world of long-term care. I mean, how does a guy from United Health find his way into this work?
Yeah, it's kind of a two-part answer. From a professional perspective, when I was at United, we saw all the time that folks in the Medicare market had a blind spot. They had some expectation, and there's data out there on this, but they had an expectation that somehow Medicare would cover some form of extended care. And we know that it doesn't. I mean, long-term care is covered in the Medicaid market. It is not covered in the Medicare market. So that was a, real source of tension with members, families that were in crisis and, at that moment realized that they didn't have adequate coverage. And on the personal side of the equation, and you made reference to this in your introduction, I did have an experience with my parents that was pretty rough over about a 4-year period where we were, as a family trying to figure out, my father had dementia that was progressive, and my mom had pulmonary disease. And, I had great clinical resources, good network. We thought we could figure this out, but it was a mess. We made all kinds of errors. And as I was going through that hard personal experience, you really start to think about families that don't have resources and frankly don't have funding to cover all the out-of-pocket expenses that are associated with whether it's home care or institutional care. So that's what's driven me, and that's why I'm passionate about identifying solutions primarily for middle-income families in this space.
Yeah, and what you said before about just kind of this surprise. I mean, I got to think, there's a sizable percentage of people out there that think that Medicare is going to cover long-term care needs, right?
Yeah, absolutely. And again, there's a lot of data, and frankly, families don't even want to think about this, right? It's everybody wants to think that they're not going to fall into that position later in life, but the hard reality is 70% of us do.
70% of us do. So over two-thirds of us are going to fall into a need for long-term care
Yeah,
costs out of pocket.
right.
Long-term care costs, and I just got to think of those families that suddenly are at need, and they go to their Medicare plan, and it's kind of a huge surprise, right?
Yeah, and if you look at the numbers on this, it's frankly it's late in life, right? People start to have functional decline generally and cognitive decline or both when they're in their late 70s and 80s. Um, so they're spent down. From a financial perspective, a middle income family has very little left at that point. They have Social Security and they have Medicare, but in terms of ability to cover what can be really significant out of pocket expenses, $50,000 a year roughly for in home care, over 100,000 for institutional, depending on where you live. It's a deal breaker for families.
Yeah, and we had Bob Kramer on the show last year with the National Investment Center, and we were talking about the same thing. And we've got middle income families, often, and what we were talking about in the opening. You've got, let's say, I'm just going to pick a persona here. You've got maybe an aging couple. They're in the home that they bought, let's
Right.
say back in the '60s. Suburban environment, all the equities, tied up in the home. They're proud to pay off the home.
Right.
For I guess the generation we have now, I mean, the people that are aging into their 70s and 80s, I think on average they didn't really have as acute an experience with paying for long-term care needs because people would pass earlier, and there was also a higher prevalence of pensions and things like that to maybe cover those costs. But that's all changed, right?
Yeah, and the other thing that's changed is family structure, right? Families are spread out in ways that they weren't historically. So if you look at, baby boomers who are heading towards this event, their kids are living all over the country. And I always do think about that family you're describing. If you think about what middle income means, if you have a 65-year-old couple that has a home that they've paid for that might be worth, $200,000, then all their other savings are really in 401k and just general savings. So they might head into retirement with a $500,000 total asset base. Um, but as a couple, they have a 90% chance of having a long-term care event between them, right? From an actuarial standpoint, it'll happen late in life and their assets are spent down. So oftentimes what's left is the house and Social Security and the kids if they have them.
And what sort of costs are we talking about here? I've been seeing it. I mean, Genworth always puts out these, costs of care surveys, and I've taken a look at them for the last 6 or 7 years, and it used to be average cost $50,000. Maybe it's 60,000. I've seen $100,000. I mean, this is not chump change.
No, and the way it generally starts is folks have decline and they need some level of support, and sometimes that's just in home support for a period of time. But typically, this only goes in one direction. A good percentage, a very high percentage of folks can stay at home, and not again to get too insurancy, but the average long-term care claim is less than 3 years. So if you can keep somebody in their home over that 3 year period to the end of life, which is where people want to be, you can, contain this at a level that's, under $200,000, in that sort of average scenario. And so when you start to think about what people need in this demographic, they need a form of extended care that doesn't, go up to $500,000, $600,000 or $1 million or unlimited. They just need to cover that sort of average gap, and that makes it more affordable and it makes it easier for them to access.
Yeah, no, I get it. I get it. And I think just having resources like that when you're at your time of need. I mean, I've heard that generally families just need a good head start, and then things kind of fall into place. But I'm just thinking of the numbers here. Let's continue to think about the numbers. We're
Okay.
thinking about here we are in 2024. We're recording this in early 2024. We're now 10 years out from that magic date that us in the longevity space know, where it's like more people over the age of 65 than under the age of 18. So the demand for these services, the demand for long-term care supports. I mean, I'm just thinking about just sort of like the you strike a table, then the vibrations hit. They hit families, they hit workforce, they hit Medicare. I don't think there's going to be a Medicare long-term care benefit anytime soon. I think that would just the cost of it just astronomical. But I'm just thinking now the impact of the Medicaid programs. I mean, it's. I mean, you say people don't like to think about this stuff, but more and more it's going to kind of hit us, isn't it?
Well, and I think there is growing recognition, right? I think baby boomers have had or are having experiences with their own families. So that sort of Medicare blind spot is starting to disappear a bit as families recognize with their own loved ones that it's a cluster financially and emotionally. And to your point on the sort of the public sector response to this, the states are starting to move, which I think is really important. So the Washington state model that launched and then got pulled back and is launching again with some revisions. There are about 15, 16 states right now that are seeing what this baby boomer movement into Medicaid ultimately, when they spend down, will do from a deficit perspective. I mean, this is going to be this will crush Medicaid programs. So there are states that are starting to focus on this correctly and come forward with sort of minimal levels of benefits that would be mandatory in the state, funded by payroll tax if you're in the public program, or with proof of having adequate private sector coverage.
Yeah, and that's the Washington State program, right? So Washington State has a payroll tax. It's going to go into a fund. That fund is going to fund the long-term care benefit in the Medicaid program. Sure.
And the exemption for individuals is if they have a qualified private sector plan.
Yeah, but I got to think, I mean, and look, there's other great Medicaid benefits that we know about. I know California and other states will pay families for caregiving duties,
right.
Which is huge. If you have to leave a job or if you have to work part-time or things like that, I mean, that's great. But just the act, I mean, again, going back to that persona of that couple that have had that home for decades and decades and decades, and now the assets are in the home, and to afford things, they may have to sell that phone. They may have to spend down to Medicaid. I mean, that's a pretty humbling process,
and increasingly difficult because the states are concerned about the Medicaid budget correctly. So the 5-year look back in Medicaid, it's the sort of eligibility will tighten up over time as the financial strain of long-term care really starts to hit the states. So you need some combination of public sector action, which we're starting to see at the state level, and private sector innovation. And that's where we're fixated. It's in creating more affordable extended care, long-term care solutions for middle-income families.
Yeah. And look, this, the history on this from a private sector standpoint. I mean, we had a lot of long-term care. I mean, I can remember, when I first started at AARP, and we sort of saw this sort of wave of long-term care insurance. I mean, maybe it's not a wave. This is just my perspective on being a brand new American immigrant at that point, so I wasn't going up on the history. But there has been this long-term care insurance. They don't offer these long-term care insurance plans anymore. What's happened with traditional long-term care insurance?
Well, the market really pulled back because the losses were pretty significant in sort of the original long-term care programs. And, there's a whole series of reasons for it. Technically, interest rate assumptions were off and mortality assumptions were off. So the programs were priced inadequately and loss ratios spiraled. What you're seeing now, and I think the numbers are less than 5% of people in this country actually have a long-term care program. And people that buy long-term care programs, they tend to be wealthier, right? It's more of an asset protection play. So folks that have a financial advisor, they want to protect their considerable assets for their family. They buy policies relatively young, and they, long-term care policies are strenuously underwritten, and that gets back to the losses that occurred, with the original sort of set of programs. So the rejection rates are high, and so when you start to look at that sort of that traditional long-term care world, and then there's another category of programs that are called hybrids, but they're basically life insurance policies that allow you to accelerate for long-term care. They tend to have very high maximum amounts. They'll cover your long-term care, but they're really expensive and they're medically underwritten. So if somebody back to our couple at 65, a light comes on and they decide that they need some form of care, they're unlikely to get through the underwriting requirements for traditional programs. And if they do, they're unlikely to be able to afford it. So that's sort of the state of the sort of the current insurance industry for middle-class families, which means, just too expensive and not accessible.
Yeah, and I don't know you to be a person that tackles small problems. We've outlined a really big set of problems here. I mean, not the affordability of care, the number of people that aren't planning for care, and not just having it's not just the money. It's just actually having a game plan, right? I mean, now you're in this situation. How do you deal with it? So all that being said, you've really fallen in love with this problem. Again, at United Church Homes, we love human-centered design. That's one of the tenets of human-centered design. Develop solutions by falling in love with the problem first. But you're now addressing this, right? You've built, HCG Secure. You're starting to put offerings into the market. Can you describe what your approach is? How you see the failings? What do you think the solution looks like?
Right. So what we've done is we have 3 products in the market right now. One is called Legacy, one is called Home Care Secure, and one is called Life Select. And what those products have in common is, back to sort of my description of that family, they're easy to access, meaning they have very high acceptance rates without medical underwriting. So it's a simplified underwriting process. We're thinking about that 65-year-old couple. How do they access care? The second thing that they have in common is that they have lower limits than a traditional long-term care, lower coverage amounts. And what we're trying to do for families is to say, hey, cover that 2.5 or 3 year gap. That's what you can afford as a middle-income family. And from an actuarial standpoint, that's what you ought to target. Don't overinsure. So they have what, in sort of insurance terms is lower coverage levels, shorter tails. And that's important as well because it makes them more affordable and less risky for the insurance markets. The third thing they have in common, which is really important, and you touched on this, is we've integrated a set of services for families that are secondary to the insurance, but really important. So, back to that couple. Most middle-income people, they retire, they don't have advanced care plans. A high percentage of them, surprisingly, don't have wills, even though they own homes. So these are families that they don't have dedicated financial advisors. They've been putting money into their 401ks. They don't typically have an insurance broker relationship because they've been relying on employer-based coverage. So they come into retirement, they haven't really given a lot of thought to long-term care. They don't have the right documentations in place. So what we've done with our insurance products is surrounded them with services. So when someone buys one of our policies, we can help them put a will together. We have a relationship with a company called Trust and Will. We can help them with their advanced care plan. If they need long-term care support, we have a strategic relationship with Wealthy, and Wealthy's fabulous. So our members get access to all of their self-service content and their care coordinators if they need to make a plan for extended care. I won't take you through all the services, but we have 7 sort of strategic relationships that are way upstream of the insurance need. And what we're helping people do is to say, hey, here's a checklist. You're just retired. Here are the things that you should have in place. We can help you. So it's a variety of services that we offer, but they're tied into the insurance, which is really, really targeting these middle-income families and, basically getting them prepared for a potential long-term care need.
Yeah. And so just, I mean, it's, we always talk about this thing about, getting people to eat their vegetables, right? And let me ask you a question under that scenario. So if I'm retiring, or rather I'm now in a position to take Medicare. Mm-hmm. I'm used to paying premiums through an employer. Now do I got extra money now that I'm sort of with the employer program and now with Medicare and then
yeah, it's actually
for affordability.
It's a great way to look at it, and we actually have a good number of large Medicare brokerage entities that are are selling our products for that very reason. Somebody's coming out of the workforce, they're moving into Medicare, which is subsidized, and they have a gap. They have a gap in this extended care space. So we actually have one of our large brokerage entities that focuses on the Medicare market starting to bundle our extended care products with MedSup. So that's, I think that's brilliant. It wasn't our idea, but it's a really smart way to align with that retirement event. We also have long-term care brokers who are moving forward marketing our programs, and they're doing that because it opens up the middle market to them. Typically, they just sell to much wealthier people, back to that asset planning model. And then we have employers and affinity groups who see this as relevant and are starting campaigns.
Yeah. I mean, it just seems like these just like you do your health check. I mean, there's this wellness check. And so if I get the journey here, I'll come in and again, the pricing. I don't want you to rattle off a bunch of prices here, but the affordability is for people that are middle income.
Yep.
They get the policy immediately. They're offered resources to help with sort of those checklist things you got to have in place.
Yep.
I guess it's just really about trying to find that magic moment where people have really sort of like hit them. I mean, because again, you've got, folks, again, you're a guy that was an executive at one of the largest health payers in the country. You struggled with organizing care at time of need. I mean, there's this great equalizer that seems to happen.
Yeah.
You mentioned Wealthy. I like the thought of Wealthy. So Wealthy is kind of like, we have a service at United Church Homes called Naviguide, where it's kind of a concierge or a resource to help you navigate challenging issues in aging, like finding a home care company or getting on a waiver program or things like that. But it looks like Wealthy is able to kind of offer something at this planning stage. And then when you're actually at time of need, you've got I don't know, I guess when you're talking about your products, someone will buy 50, 60, 80, 100, $200,000 worth of coverage. They're starting to get those resources. Correct. And then now, so you plan, you offer planning support at the start. You're in contact with people because I'll tell you something, man. With my life insurance program from USAA, I hear from them once a year when my just to reconfirm my policy, what I pay every single month. Between the time where they sort of get these resources and then the time of claim, are you still keeping in touch with them?
We are. So, very specifically, when someone receives their policy, what's called their fulfillment kit, they get a description of all the services that come upstream from the insurance. Then we're doing regular outreach, trying to engage members, sending them checklists, letting them know what services are available, directing them to content that we're delivering. So we're absolutely focused on engaging with consumers to really have them take advantage of the services and have a plan. I mean, if you fall into that category of 30%, you never need the long-term care insurance. There's still value in all these upstream services in terms of getting your life organized for your loved ones.
What sort of feedback are you hearing there? I mean, it's I've lived through experiences at AARP where I worked, in home care, others where, again, it's just this idea that you're seeing, and I'm an economics geek, so I can see the wave. And by the way, with Ruth Frost Parker, we do not call it a tsunami because tsunamis are destructive. So hashtag ageism. Has there anything that sort of comes to mind or learned about, what kind of motivates somebody to take action here? Or are there certain types of, is it just a certain type of person that's more of a planner? Or are you, I mean, again, with the way that you've developed this set of solutions, you've gone through a lot of test and learn.
I think, and we're pretty early, but I would say it's sort of the personal event that occurs, right? Someone's parent went through this and an adult child, 50, 60 years old, got drawn in and realized how difficult this was, and then recognized that they have that gap, right? So there's the personal event that will motivate people towards products like this. But I also think, and we were touching on this, it's that moment, transitioning into Medicare, or if you have a relationship with a broker who reaches out and says, hey, Mike, this is a gap in your plan, right? You've got life insurance, you have dental, you've got Medicare, you bought your vision plan, but this is a gap. So I think there's There's different ways to get people to eat their vegetables. I think the most powerful is certainly that personal experience, which again, more and more baby boomers are living through.
Yeah. And I think that it's. I mean, we always like to say that there are brands out there that have really just spent decades just putting their association between help at time of need and the situation you fall into. I'm thinking of things like A Place for Mom and all that. Where you're talking about solutions that emerge right at that moment, and then you reach for it, and I mean, and that's I mean, look, you're early into this space, you're building the brand, you're working through these channels, and do you see any? I mean, I know we've done a lot of conversations on the show with people in the venture capital series space. I'm hearing more and more about an interest in fintech solutions. Right. Sort of are you seeing kind of this momentum where, I mean, you're in this space, other players are getting into this space. How's the energy around fintech right now?
Yeah, there's a lot of interest and money flowing towards the caregiver solutions, right? The moment where you actually need to make a plan. And then there's a lot of movement in the sort of flowing into the fintech from a underwriting perspective, more efficient underwriting. What we're focused on is bringing it together. And I think that kind of is, what we view as our secret sauce, which is we're creating these unique insurance plans that are easier to access, and we're bringing in the support services. And so the experience that we've had with this is really high conversion rates at through the sales process. And frankly, a lot of large brokerage entities, distribution sources who are coming into contract because they see this issue and they think that they can effectively promote and sell.
And where my mind goes now is just kind of back to those players that were offering these solutions back in the 80s and the 90s. You get the Hancocks, the Prudentials, the G's, Genworths, and all of that. Have they got? I mean, I know they've got probably a lot of claims that are on their books right now, and that takes a lot of capital to cover. I mean, are we seeing innovation from the big players? Are they now looking into these kind of more hybrid or fixed indemnity or whatever types of solutions?
I think the short answer is less than you might anticipate, because you touched on this. They're managing their books, and the industry got pretty badly burned. So there's a lot of sensitivity on offering products with simplified underwriting, even if they do have sort of lower coverage amounts or shorter tails.
Yeah, I get it. And before we wrap up on this subject, I just want to ask. Well, first of all, we always like to ask our guests these 3 questions about their own personal experience with aging. And I know we prepped, and you're fine with me grilling you on this one.
Yeah.
This show is a hopeful show. This show features folks that are really addressing the big issues that we have with aging here. And how do you have a sense of hope about the future? Is this something where you see there's lights at the end of the tunnel? Are you starting to see things come into place? Are you worried? What gets you excited about moving forward with this project?
Yeah, I've got a ton of energy on what we're doing, just because it is such a large problem, and the reception we're getting from the market, brokers and consumers early on is really strong. So I believe in what we're doing. I think we're designing programs and creating these integrated solutions in unbiased, but in a really smart way. And we're getting a solid initial reception. So I'm very optimistic.
That's awesome. Okay, so now to get to our 3 questions. Okay, are you ready?
Ready.
This is great, because usually in my other questions, I basically freeform it, and I tend to ask 4 questions at once. So thank you for being able to kind of unpack that and come up with a decent response. Also, shout out to my mom. I'm trying to speak slower on the podcast. If you want to listen to this. Okay, question number 1, Tom. When you think about how you've aged, what do you think has changed about you or grown with you that you really like about yourself?
Yeah, I would say, I've given this some thought. It's patience, right? It's recognizing that you can't control everything, and it's having the patience to be persistent and just keep at it. And I think that's a major factor as you get older.
I gotcha. But now the question too, though, but what surprised you the most about you as you've aged?
I think it gets to the question you asked earlier. It's just I have passion and ongoing energy to solve problems in an area where I've got frankly decades of expertise. So just applying my subject matter expertise, my network, to a problem that I think I can solve.
That's awesome. But number three is there someone that you've met or been in your life that has set a good example for you in aging, someone that's inspired you to age with abundance?
Yeah, I'm actually surrounded by people that are, older, right? 60s, 70s, 80s, 90s even, who are just still going for it, So without naming names, I have a friend who's 74 who still competes every year in the CrossFit Games, and is, at that gym 5 days a week. One of our investors is Alan Patrickroft from Primetime. And Alan is an absolute inspiration in terms of the energy he brings, the ideas that he brings. So I'm just surrounded by people that aren't worried about their age and just keep going for it.
And that's terrific. And that's something we've heard from other guests that, just having these, and I think it goes both ways, sort of being inspired by younger people, older people, but there seems to be this through line of energy, passion, curiosity that kind of keeps people wanting to turn the pages of their life book,
And to me, that's actually a really great point. It's not age. It's, are you interested in staying on a learning curve? Do you have the energy to make a difference?
I love that. And I think that's just a great way to wrap up our show. Tom, very much appreciate you being on the show today. And before I thank our listeners, Tom, where can we find you? Where can we learn more about HCG Secure?
Just go to hcgsecure.com. You've got sort of the ways to contact us, great content, I think, and product descriptions.
So a special thank you. The biggest thanks, of course, to our listeners for listening to this episode of The Art of Aging, part of the Abundant Aging podcast series from United Church Homes. And we want to hear from you. How concerned are you about the future costs of long-term care? What are you doing to look ahead, perhaps? And how do you anticipate aging? What surprised you about this podcast? Who is your abundant aging hero? We want to hear from you. So visit us at abundantagingpodcast.com to share your ideas. You can also give us your feedback when you visit the Ruth Frost Parker Center website. That's unitedchurchhomes.org/Parker-Center. As Tom said, find out more about HCG Secure at hcgsecure.com. And again, our sincere thanks, and we will see you next time.